This is Samantha.
All right. So this video, we're giving tips to nursing students. Let's get straight to the point. First tip, I would say, Sam, you may or may not agree. I think you will agree. It's okay if you're not in a study group. Do you
Yes.
agree?
Yes.
It's okay. Now,
Yeah.
for undergraduate, I was in a study group with Sam and two other lovely ladies. Graduate school, now I'm currently in graduate school, not so much. I mean, we have group assignments, but it's not a study group where we meet every Wednesday, we read.
Right.
It's not like that. If you're a person who works in groups, that's great, but don't feel bad if you don't. It's okay. I think you should still have a group of friends so that, you know, if one person finds a resource, you all be willing to share it, but you guys don't have to sit down in the library for hours studying if that's not your style. You're probably doing more harm than good for your own grade, right?
Yeah.
Okay, what's next?
So, do not be stingy with information. Do not. If you have notes, if you have study guides, and like, you know, you're not friends with somebody, but you're cool with them, and it's like, you know, they're giving you information like, oh, hey, make sure to look out for blah blah. It's okay for you to share your notes. Like, it's fine. Like, you know, I don't see it as, oh, well, I studied and I did this and that. They ain't do nothing. I'm not giving nothing. That's stingy. That's selfish. Because if I know that maybe this one, Lizette, probably has a kid or something, and she working and she's studying hard, and she can't really make her notes because she worked and she has a kid and she has a husband or whatever, blah, blah. Yeah, I'll give you my notes. You can take my notes. Do what you got to do. Like, as long as you pass with me, that's all that matters. We came in together. We leaving together.
And honestly, nursing is a small world. Like, you'll bump people you went to school with, and you don't know what position they'll be in 10 years from now. Or they may be the one sitting across the table interviewing you. So you really want to be remembered as that person who didn't share anything?
I think not.
No. Okay, another tip I want to say is, really take the assessment skills seriously, especially in undergrad. Because, I mean, there's a lot of things in nursing school, technique-wise, that you're taught where it's like you get into the real world and you're just like, But assessment skills, that's definitely something like the lung sounds, palpation, things like that. I would, if I can go back in time, I would pay more attention to that.
Yeah.
Because when I became a nurse, I had to relearn certain things that I didn't take seriously because I knew it wasn't going to be on the exam. I mean, just being honest.
Great.
Right? So take your assessment skills seriously.
Yep. And in that same conversation, listen, I know you need a pass, but leave those bed baths alone.
Leave those bed
baths. You are not going to be, listen, just to get your grade, listen, I'm going to be as real as ever, because bed baths did not help me. It didn't help me. What am I learning? Cleaning. You know what? We have a video on bed baths. You can check it out. Y'all can go check that out. But honestly, though, you guys already know how I feel about bed baths. Like, I don't work med-surg, but I work in emergency. But when a patient is soiled, I clean them up. Yes, I do. But if I'm doing actual bed baths with a bucket of water and soap, no, we're not doing that. We don't do that. There's no time for that.
We're not
trying to be funny. Like, I'm just serious. Like, we don't have time.
We're not doing mitered corners either. Like, we don't even have
the full thing and clean your bed. Like, no, we don't even do that at home. We don't do that at home.
No, ma'am. There's no fitted sheet over here. Another tip I have, oh my God, start networking. And you know what? I'm not going to be so vague because I would hear people say it, but they didn't give examples of what networking looks like, right? Networking is simply talking. As you can see, we're both chatty patties, so that naturally comes to us. But you can network with your clinical instructor. I think that's probably like sometimes the best people to network with because they work in hospitals, they're doing clinicals in these sites. They know someone that knows someone. I don't know if you remember, Sam, in our baccalaureate program, when we were taking that professional class, remember the student who just told the professor, like, the last day of class, I need a job. And he said, give me your resume and I'll get you. I'm like, why didn't I see?
And you know what's crazy? That same professor is the top notch in our hospital where we work right now.
Yeah.
See these things? You always meet someone where you go. You never know.
So definitely. Another way to network would be if you're in undergrad school, right? And you know that you may want to pursue graduate school, I would start talking about it now with your doctors that you visit. So when it's time for you to find clinicals, you can be like, hey, I'm here for my annual, but also I'm here to see if you're going to like be my preceptor. Like that would be a great way to start networking. Something I wish I did, but did not. What else do you have, Sam?
So in that same sentence, it's like every time you say something, I find something to just be like.
Another thing.
Okay. True. Just my advice. Listen, life happens, but do not take any breaks. Go right through. If you get your associate's degree, do not stop right there. Go right for your baccalaureate degree. If you get your baccalaureate degree and you know deep down inside you want to get your MSN, listen, just go and do it.
They should get some experience, no?
Listen,
that's another video.
I know people who got experience while they were in school. They were new grad nurses and they were still going to get in their MSN. But MSN doesn't mean that you're getting your FNP right away. Like you probably want to be a nurse educator or whatever it is.
True.
But just do it. Just go right to school. Don't take no breaks because sometimes you get lazy and then to try to put yourself back in that motion to try to study and do this and that. Like get it while you're done, do it, and that's that. Also, take advantage of tuition reimbursement. Take advantage of it. Like when you start working at a job, like if you know that the job offers tuition reimbursement, take advantage of it. You go right to school and do your thing. It's not coming out your pocket. And another thing, stop thinking these top-notch colleges, oh, I want to go to Howard University. I want to go to Yale. Listen, we graduated from CUNY City Tech. Okay, a community college.
How much depth are you in, Sam, from getting
I ain't got no depth.
Back? I didn't even ask the question. No, but seriously, okay.
Thankfully.
We graduated high school around the time of the recession. I graduated the year the recession was like official. I already knew that my parents did not have the resources for me to go to a private college. I was very realistic with what I could afford and the fact that debt really scares me. Like there's good debt, bad debt. Bad debt scares me. And so I went to a community college and I'm so thankful that I did because a lot of my coworkers and friends outside of work, when I hear them talk about how their paycheck is just basically cut in half from paying student loans, I'm like, that's the biggest scam ever. I graduated with 2 degrees and associates and bachelors, just like Sam, with $0 in debt. And now I'm going to grad school. We're both in a SUNY. Well, Sam is done. Congrats to you, Sam. I'm here to go. But yeah, we're currently in a SUNY school, and thanks to tuition reimbursement and that the tuition is not so high, I am going to get my master's as a women's health nurse practitioner with $0 in debt.
Won't he do it?
Like, tell me about it. So definitely take the school's tuition into consideration. And fortunately, nursing is not a profession where they really look at your school. Now, if you wanted to be a lawyer, then I'm telling you, you need to get into the top 5.
Right.
But for a nurse, luckily, they don't really.
It's the same education.
Huh?
It's the same education. You may not have like professors who will go in for you and will go above and beyond.
There will probably be a difference, but
but you're still learning the same concept. Like we're all taking the same NCLEX. Like it's not the same question.
Right next to that person who went to a private college getting the same salary. Keep that in mind. Perspective.
Keep it in mind. Let it marinate.
Do you have another tip? I'll just piggyback off of you.
Yes. Competition. Stop competing. We have a video on that. Please check that out. Stop competing. Stop competing.
So can we give a quick story time? I remember one time we were studying for an exam in undergrad, associates, and I can't remember. It probably was associates. And then we found out that a group of students had a review sheet, not answers, but a good review sheet. And I think they took pictures of it. But anyway, they threw it away or they hid it when they saw us coming. And till this day, I'm like, you did all of that for us all to be registered nurses at the end of the day. Like, don't you look dumb?
You know, it's crazy. I laugh at stuff like that because when you really look at it, like, even if you had that review sheet, at the end of the day, we made our own review sheet. And we still passed, and we graduated along with you. We didn't
don't get so caught up in grades.
Yes.
I feel like now more than ever as a grad student, I'm always like, the low, I got an 85 on the exam, and I was just like, what is this? I was really up like this, like, that doesn't, I'm not a B student, like, come on. But and then I thought about it. I'm like, you know what? Be happy with what you have, right? Because when you go on your interviews to be an NP, they're not going to ask you, what grade did you get in pharm? It's not an interview question that they do.
It's not that serious.
And at the end of the day, your goal is to pass, take your boards, cross the stage, all that good stuff, make your family proud. It's okay if you graduate right at the minimum. Always aim for the stars, yes, but sometimes that C is your A for that exam. Who said Professor Thomas?
So my professor for grad school, I could always keep remembering in her emails she was sent us, and she's like, you overachievers, don't go above and beyond for me. I don't care about your little sparkle that you add. She wrote that in the email, and we were just like, how do you insult us like that? She's like, she addressed us to the overachievers. And I was just like, the shade is real. So they ain't looking for that. They just want you to pass and really go. Like, take the boards. The main thing is to pass the boards. That's your main goal. Pass the school and pass the boards. When you are in clinicals, try to find someone you see, a nurse or anybody. Try to learn as much as you can. Like, if you're like buddying up with a nurse, your preceptor says, oh, go buddy up with this person over here with this nurse. You're going to be with them for 6 hours. Don't let them limit you to just cleaning someone's butt. If the nurse is giving medication, you watch them. Ask them what the medication is. If you are the person who likes to take notes, then you take your notes. I'm not a note person. I like to watch. Once I see something once, I learn it, I get it, and that's that. I go back home, I let it marinate, and I go research on what the medication was that I gave that I did not know. Mm-hmm. That's it.
No,
other than that, there's no time for you to be cleaning people's butts and stuff like that. Because when you get in the field, it's not all about cleaning butts. You're gonna have people crashing on you. You're gonna have people who you have to critically think. You have to know how to treat them right then and there.
Start getting comfortable speaking to people, because when they would say in nursing school, like, as a nurse, you're everything, you're this, you're that. I'm like, it's so true.
It is.
Like, you are every woman when you become a nurse. Like, they expect you to know everything and to do everything. So you need to be able to speak up. You need to learn how to delegate. But most importantly, you need to know how to advocate for your patients. So get comfortable with speaking up and clearly and getting your point across without being long-winded.
Don't feel guilty about wanting to have time for yourself, like to have me time. You know, because sometimes we get so wrapped up in studying, you want to pass the test, that you don't take care of yourself in the same sense and mentally take a break. Like, you have to mentally take a break sometimes, because when you're studying, you find yourself where you're not retaining anything. And sometimes you need a mental break. If you have to go watch a movie for an hour or two, go do it. If you need to go watch Love and Hip Hop or some ratchetness or whatever, just do it. You got to go take a shower to clear your head, do it.
I remember after my exam for grad school, remember my patho exam, I thought I failed. And I'm like, no, I'm going out today. Like, I was like, I put on a cute.
Yeah, I remember we went out that night.
And everyone was like, how did you did well on your exam? I'm like, no, I probably failed, but I'm having this drink.
But then the next week or something, you was like, I got a 95 or something like that. I was just like, oh, yeah. You're going to clinical. You have your stethoscope ready, your pen light, you have your pen because you're going to be documenting when the nurse is giving you a report. And if you want a notepad, you could bring your notepad too. Make sure you have a watch so that you can document respirations and stop putting 16, 17, 18. No, I was just playing.
I'm not going to incriminate myself. So
I'm not either. And that's the reason why I said get your watch.
Goodbye.
All right, guys. Bye.